Hey, everybody. Good morning, good afternoon, and good evening, wherever you are in the world. Hey, I'm really happy to be with Dr. Michelle Kinoshita in Canada, actually, Toronto. How are you, Dr. Kinoshita?
Very good. We're actually not in Toronto. We're in Collingwood. We're 2 hours north of Toronto.
Oh, okay. You're from Toronto.
I'm originally from Toronto, and I moved up to Collingwood for really for lifestyle because this is kind of like the outdoor playground of Ontario. We have skiing, we have sailing, we have swimming, we have cycling, golf, if you want to do that.
Wow. Yeah. It sounds like Colorado.
Not quite as mountainous as Colorado. Colorado's a little bit nicer. Um, you're drier though.
Yeah, we're very dry over here, but not our humor. I'm really excited. If you want to talk about your dog, if your dog has tissues, if your dog has issues with their tissues, that's how I like to say it. That is all things muscle, joint, fascial, ligament, tendon, especially if you have an older dog or a really active dog. Get ready to listen to some cool therapies and ways to help your dog feel better and behave better, move better. Because Dr. Kinoshita does really the whole, I mean, if not the whole exact enchilada, like 95% of it or more. So this is we're talking uh, Chinese medicine. Okay, that's the good foundation and basis. Um, Veterinary manipulation, which she's certified for. Acupuncture. Uh, Gosh, there's so many here. I have to read. Electroacupuncture, laser therapy, food therapy, flower essence therapy, homeopathy, and ozone therapy. That's a lot. I don't see chiropractic there, so that's one thing missing, right?
So, because we're in Ontario, chiropractic is a term that it's only allowed to be used by doctor of chiropractic medicine.
Ah,
So, manipulation therapy is actually chiropractic done by a veterinarian.
great.
And where I trained was Florida also, and Florida is not allowed to use the word chiropractor for veterinarians either.
Right. I do know that about Florida. So yeah, so that's very interesting. So a lot of times they'll use different words in the states to but basically use chiropractic as a practice on dogs. I've used almost every single one of the things you do on my dogs, so I can tell you firsthand with miraculous results. Dogs, I think I pretty much started like over at the age of 13 and older, and boy, you really can see quality of life and vibrance when you apply these to especially older dogs or real athletes. If you've got athletes or competitive dogs, folks, start turning your attention to this stuff. So let me ask you this, Dr. Kinoshita, what is it that got you to focus in veterinary medicine on this topic, on this specific topic of movement? It's all movement.
Well, that's kind of funny because actually I don't focus on it. Um, where what the reason I'm focusing on it now is that my patients are aged. They're almost all over 10 years of age.
Wow.
Because I've been doing this for a while, and they've been with me since some of them have been with me since puppies, and they're getting stiff and they're getting arthritis problems. So I need to focus on this because that's what my patients are demanding. But in fact, I also see skin disease. I also see inflammatory bowel disease. I see cancer therapy. But those aren't the dogs that, I mean, all of those dogs originally, some of them saw me originally for those problems. We've got those under control.
Yeah.
Now we've got arthritis going on. So that's
Yeah.
why I focus on it now. That's why I'm concentrating on that. But I still do have animals with some, digestive issues and that type of thing. So I am
Sure.
seeing some younger ones too. But yeah, it's what my patient population demands me to do. That's why I do it.
That's so cool to phrase it that way. Like you've kind of just moved with your patient population as they've gotten older. That's really a cool concept to think about.
Yeah, I mean, as veterinarians, I mean, the most important thing to us is our patients. So if our patients need that, that's where we're going to go.
Okay,
Just
I
makes
like
sense.
that. Well, so let's break these down a little bit one by one, because I want to focus on the movement stuff. I have a huge heart for older dogs, having had them, and my dog Gus now, he's 7, in a few months 8, and he's still really he's super. I think biologically he's very young, but I start to think about this now. What is 12, 13 going to look like for him? And so I'm constantly with him. He's an athlete, very jumper, all that. So I think about I do chiro on him, I do acupuncture, I do all that stuff regularly. So let's start with like the manipulation, the chiropractic. Start with the big things first, and we'll go down into some finer therapies. um, how do you think about advising people? What would you say to people watching about how they should be thinking about when and how much to do of chiropractic with their veterinarian,
Well,
or manipulation? Sorry, medical
yeah,
manipulation.
that's okay. You can call it chiropractor. We do. I mean, we just can't advertise it that way because we get in trouble.
Yeah.
Um, well, you have to understand the reason I took chiropractic wasn't because I wanted to be a chiropractor.
Mm.
I kept on saying to my clients, it's like your dog could benefit from chiropractic therapy. And then the next time I saw it for its acupuncture, it's like, did you see the chiropractor? No, I haven't. And it's like, okay, I'm just going to have to learn it so I can do it on your dog because they don't want to go to other places for it. So I'm kind of like the one-stop shopping place. You bring your dog here, and anything that I think your dog is going to benefit from, that's what I'm going to do. So the chiropractic is almost like an aside for me.
Yeah.
When I do my treatments on my dogs, I almost always start with some laser. And that's just to get the muscles to relax a little bit so the dog is going to be more comfortable. And then I'll often go from there. I might start actually put my needles in. And then once I've got everything relaxed from my needles being there, and I might do some fascial treatment too. And then once they've got that, then when I do my adjustments, it's going to be a lot easier for me to do them, and they're going to hold longer. So it's kind of like that's the last thing I do. I used to do it at the beginning. I used to do it during my exam, but I found a lot of the dogs didn't like that because they
Yeah.
hurt.
Uh,
So I wanted to relax everything first and then do the chiropractic at the end.
well, I'm just thinking of my own life. I've had chiropractic my whole life, and a lot of acupuncture too. But I was in a car accident pretty within the last couple of years, and I hit that so hard with the therapy. And one of the things we did was massage first, which sometimes can be good and bad before chiropractic, but it was in the same office. Sometimes needles before or after chiropractic, but I did them all three together. And boy, I could not believe how fast I healed. I mean, it was miraculous, but I threw the kitchen sink at it. And, I was honestly, it wasn't that easy because I was in the office for a total of like 2 to 3 hours at a time. But boy, that combo I have felt in my own experience is like a miracle when you combine those things, and you have somebody who can do all those things. So can you explain a little bit about fascial work and those other therapies that complement chiropractic or manipulation?
Yeah. So when you're doing an adjustment, basically you've got a joint that might be just a little bit out of alignment. I mean, this is over exaggeration, obviously. It's not going to be like this, but it's a little bit out of alignment. And you're
Mm.
trying to put it back into alignment. But if you've got all the tissues surrounding it all tense and you try and move that, it's going to be painful. And if those tissues are kind of stuck together, like fascial tissues, they kind of get sticky and they get stuck and they don't move like this anymore. There's like this.
Yep.
Well, you can try and move that, but it's not going to move, or it's going to move and it's going to go back because it's like an elastic. It goes back again. So if you can release those and get them moving more smoothly, then when you do your adjustment, it's not going to go in like an elastic and go boing back to where it was before. It's going to stay where it is.
Yeah.
So all of those other, like the fascial releases, they help to allow the tissues to remain where they're supposed to be in the balanced state. If you try and do it without it, then your chiropractic adjustment is not going to last as long. And that may be wise for some people. They do have to go so often to get a chiropractic treatment because it just bounces back to where it wants to be. And that's again why it's good to combine it with other things, like even the massage therapy beforehand, to relax all those muscles. And so that it doesn't have the memory of where it was when it was in a bad state. You want to
Yeah.
erase that memory and put a good memory in there.
Okay, great. So I want to go a little bit deeper into fascial work, what it is, how it works, what it does. I also have constant experience with this. My trainer does fascial work. I feel miraculous benefits from that. If you do it, if you have to do it intensely, it can be a real workout in and of itself. I've like broke a sweat from getting fascial work before. But I can attest to its miracle on myself and my dog. So will you tell us a little bit about how that all works?
Well, my husband's a massage therapist and he does fascial release. And when he does fascial release on me, it hurts. If I tried to do that on some of my dogs, they would bite me.
Yeah.
My patients love me, actually. They come running into the clinic and they're like, "Hi, I'm here," because I don't do that kind of fascial release. The fascial release I do is actually more using meridians, the acupuncture meridians.
Okay.
There's actually some doctors, veterinarians, who have mapped out the fascial planes and how they are connected with the meridians of the body. And one of the techniques that I learned was actually it's a very simple kind of osteopathic type of technique, because it's not a lot of pressure and it's almost more intention. So you find your fascial planes and how they're moving, and where the fascia comes up to the surface, you can put your hand there, and you find another spot in that same fascial plane and you put your hand there, and with the intention, then you're telling the body you need to do something, and the body will release. And you watch the pet and you look for that change, and it can be a very subtle change, like a change in breathing, or just a kind of, they look at you, it's like, they feel better. And so that was pretty neat. So I was doing that for a while. It was taught by one of my friends, and I was actually really impressed. I mean, a lot of the time I get these restrictions around the knee, what would be the human knee, the stifle. And I've always found those to be very hard to adjust because there's so much scar tissue. And then I started doing the fascial releases, and it's like, wow, these actually started to move. But it takes time. I mean, you've got to hold your hands there for a while. So I was attending this other conference, and this rehab specialist, the veterinarian, was talking about using tuning forks. So what she does is tuning forks of a certain hertz, a certain frequency, help to release the soft tissue, the fascial restrictions. And so I started using the tuning forks to help with my fascial restrictions. And I first tried it on myself, and I really got some benefit from it. I get this pseudosciatica down my leg, and I can barely walk sometimes.
Ooh.
If I were to sit down and put some acupuncture needles in early enough, I would be able to treat that. But I never take that time. So I tried it with my tuning fork, and much faster than I could ever have gotten a release with my needles, everything's calmed down. So I started using it on the patients, and some of them, I was just the other day, I was doing one on this one dog. It was the first time I'd ever done it on her, and she just relaxed and she went to sleep. Whereas when I was doing my needles, she was actually being kind of antsy and moving around. And then I started the tuning fork, and then she just like relaxed. It was pretty impressive.
Wow.
So she obviously had pain, and we were able to actually decrease that pain for her.
Yeah. Well, the last thing you want with a dog that's tense already and holding really hard and in pain, obviously, is more tension, more, more jerking around and certainly more pain. You don't want that. So it's interesting to have that tuning fork as a way to maybe get in there a little bit.
Yeah, I find it just really helps a little, that extra little bit without causing any pain. There are some dogs, when I put the tuning fork on it, they don't like it so much. And you can actually introduce it a little more gradually. You can put your hand on it and then put the tuning fork on top of that, so they get used to that vibration. And of course, there's also the sound of the tuning fork. So sometimes I'll just hold it up and let the dog hear the sound, because they're like, what's that? Right?
Yeah.
They're more sensitive to sounds than we are.
Yeah.
There's ways to get them used to that so they'll accept it more readily.
Yeah, no, makes total sense. So for people who are like, tuning fork, first of all, what does it look like? What is it? Or for people who know what it looks like, they're like, how does that do anything? people have used those things on, those hammers on your knee, and they have a vibration, or maybe they're tuning forks on your knee. I feel like I've had that before. But how does it work in your world? Like, what is the mechanism of it working?
Well, there are different tuning forks with different frequencies, and there's
Okay.
actually different ways of using a tuning fork, because there are people who are using tuning fork really more for the sound therapy, because
Okay.
you can use the different hertz of the different sounds for different things. So this one is a middle C. It's 128 hertz. So it's probably the most common one that's being used for musculoskeletal soft tissue releases, fascial releases. But you can also use a different frequency also, which it's called ohm. I think it's 136.1 hertz. So there's that school also. So it's a slightly different school where they're using that, and that one they seem to go a little bit more into they'll do things like fifths and thirds and that type of thing. So they'll use different frequencies at the same time to get different releases. But it's still, again, good for soft tissue. But you can use other frequencies for other things. For example, if you perhaps you had a dog that was very aggressive in the room, and then your next appointment is going to be a very old dog is very sensitive to things. So maybe what you want to do is you want to clear the room with your sound therapy of your tuning fork. So you could use it that way. That's not how I'm using it, because I only have the one tuning fork, because I'm just getting into this. It's pretty new for me. So what I'm using this one for is specifically for the fascial releases. So it's 128 hertz, and you can either after you vibrate it. So I have this lovely little thing that you can tap on it, and then it starts to vibrate. Okay. I don't know if you can hear this.
Yeah.
Nor my microphone.
Can't hear it. No.
And then, so that's the sound. But what it is you feel the vibration down here. So this actually vibrates.
Yeah.
And if I put my hand on it, it dampens it and it stops vibrating. But if I get it going, I can feel the vibration here. So then, especially if I put it on an acupuncture point, I can really feel it when it goes on an acupuncture point. Okay. The other way I do it is this way, which is going across your fascial planes.
Wow.
And that vibration will help to release the fascial tissue. So there's different ways to use it. So I could put it on acupuncture points. I can also just put it on a trigger point. It's actually really good for releasing trigger points. So if you had a really tight muscle here, you go over that, especially people with shoulder issues, they have that tight muscle right there. You can put that over that spot, and that vibration will help to release that trigger point. And that's actually one of the ways that I used it on myself, and I noticed a big difference.
I mean, because this is just really sound therapy, right? I mean,
it's a form of sound therapy. Yes, because you're talking about the hertz, the vibration of the sound going through this and going onto your tissues.
Wow. So I also have experience with sound therapy. There was a rehab gym that I went to a long time ago, and you would sit on this and you'd hold I remember some like handlebars or something, and it would put sound waves through you. You barely could hear it, but it was for therapy. And that was my first introduction that sound could be a healer. And so can you explain, like, what is it doing? There's obviously some just natural magic that nobody understands, nobody can measure. There's just a communication between that device, the device, and the fascial tissue on the animal. But like, is anybody able to explain it? Is it?
Well, as I said, I'm just getting introduced into this. So my explanation would be that all of our body is full of water, and water vibrates. And you can vibrate water at different frequencies to get different changes within the body.
Yeah.
Also, we know that certain sounds can stimulate different feelings.
Yeah.
And so the different frequencies of sounds can be used. I mean, they use different sounds actually to help calm animals. There's this whole thing about, the different harmonies, mostly in classical music, actually, that you can use to calm animals. And that's frequencies of sound.
Yeah.
So it can affect in so many different ways, but a lot of it can be emotional too. So that was what I was talking about, like clearing a rune from the bad energy. That's an
Yeah.
emotional type of thing. So the different frequencies can do different things. So you talk, I mean, when you get it really more into talking about sound therapy, people would be thinking about Tibetan singing bowls, or, you know, people who have the gongs and they push the gongs and all the sound that reverberates around you. And I'm not doing that, but there are a lot of people who do that type of thing. And it all has to do with the fact that you're vibrating your tissues in different ways. Because
Wow.
I mean, what are we, like 90% water or something? So
Yeah,
there's
yeah. Did you ever see that video about like people talking to water and you know just or music and what it does to water, like a glass of water and it does to the
yeah.
molecules?
Well, there's this Japanese, I think he's a scientist, that Dr. Emoto, and he studied water, and he talked about, you know, if you put the crystals of the water, and if
Yep.
you write, say, the word love on it,
Hmm.
and then he would examine the crystals that formed, and then he would write hate on the bottle of water, and then he would examine the crystals that formed, and the crystals that had love on it were beautiful crystals, and the ones that had hate on it were awful ugly crystals. And
Yeah.
that's very interesting. I mean, that's not so much sound, but that's water, and that's the energy of a simple word.
Yeah.
So, you know,
Yeah.
it's quite interesting. The water can
Yeah.
do all that.
I saw that. The my takeaway from that was intention and
Mhm.
you know, you can write it down, but you actually don't need to write it down. You can just be intentional, think
Yeah.
about it. But yeah, there's so much stuff that's magical in the world that we just have no clue about, you know, except we need to, you know, be open to the magic, you know, and if we want to experience like magical things.
Yeah. I think that's the biggest thing, is being open to it, because yes, we know a lot, but there's so much more that we could learn if we're open to learning about it.
Yeah,
And that's the thing, is like, you know, if you don't believe something's going to work, well, it's probably not going to work, because you've put that blockade up.
yeah,
So you have to be open to accepting things.
yeah. Do you think there's more that we don't know than we do?
Oh, yes, absolutely.
Right. Yeah. I don't think people even take a minute to think about that, but you know, we're always so sure of what we know and we've got all the answers. And if this happens, this must be the reason. But you know, approaching health issues, medical issues with humility and an open heart, and mind, I think is probably one of the smartest things you can do for
Yeah.
you and your pets. All right.
Well,
So yeah,
if you think about, I mean, our medicine is built on, basically, on Newtonian physics, but we've actually discovered that Newtonian physics isn't actually right. And if Einstein had lived longer, we would have learned more about quantum physics.
yeah, yeah. The quantum world is crazy. All right,
Hmm.
so let's dig a little bit more into complementary therapies. So most people know acupuncture involves needles. So can you tell us a little bit about electroacupuncture? Why do we need electroacupuncture? What's the purpose?
Electroacupuncture is just stimulating the needles a little bit more strongly than you would get with regular, just putting a needle in. So you put a needle in. One way to stimulate it is you could twist it, or you could put it up and down. But if you put the electroacupuncture at certain frequencies, you can do the same sort of thing in multiple spots. And so, like, I only have two hands, so I can only manipulate two needles. But if I put electro on it, then I can stimulate 10 needles in the same way if I have enough leads. So that it's just a way of stimulating a little bit more strongly. Usually we're using it for musculoskeletal issues, but you don't have to. One of my teachers, Dr. Steve Marsden, who I think you've interviewed before,
Yep.
um, he uses electroacupuncture on a lot of the needles. As long as the animal is staying still, then he'll stick it on the animal. Problem is getting the animal to stay still long enough for you to put all those in.
Yeah, yeah. My dogs didn't mind it. They loved it. And I was like, "Hey, let's do as much as we can in this visit." So, okay, so electroacupuncture, let's talk about imagine if you will, you get your dog gets an adjustment, folks. Your vet then starts to put needles in, then throws these little, connectors that'll drive a little bit of current, little baby bit of current through the needles. So you've got that going on. So now your dog's hooked up to some like wires and stuff. It's pretty funny. And then your vet brings out a laser. So tell us what the laser, how it complements all these therapies.
Well, I usually wouldn't do it at the same time as all of that. In fact, the reason I do the laser first before I do all the other things is that laser, if you have acupuncture, helps to stimulate blood flow.
Yep.
If you've got too much blood flow going on, the laser actually doesn't necessarily penetrate as deeply. So I like to do the laser first. And there's different schools of thought on that too, but that was what I was trained with. It's like doing the laser first before you stimulate all the blood flow, so that you can get better penetration into the tissues. Okay. Occasionally I will use the laser while I've got the needles in, but most of the time I do it first. And so the laser, what it's going to do is it will penetrate into the tissues. And if you put it over an acupuncture point, it's actually going to penetrate more deeply than in the adjacent tissue. Okay. And that's because the acupuncture point itself has a different resistance. And so the light energy can actually penetrate more deeply. Whereas if you shine it like, centimeter off to the side, it wouldn't penetrate as deeply. And what you're trying to do is you're trying to get it as deep as you can into those tissues in many instances, because maybe the problem is further down in there. If you're trying to treat a joint area, you want to try and get it down to that joint, and maybe the joint is fairly deep in there. But it's going to go and stimulate the cells and the mitochondria of the cell. The mitochondria, we call it the powerhouse of the cell. It's the one that produces all the energy for the body. And if you can stimulate that one well, then it's going to make changes within the body. And really, what changes you want the laser to do would depend on what points, acupuncture points, if you're doing laser acupuncture, but it also would depend on the frequency of the light energy that you were putting into that acupuncture point or into the tissues, wherever you're doing.
Okay. Well, that's very interesting. And you're using a cold laser.
Yes, I use a 3B laser. So it's a cold laser. It's actually designed for an acupuncturist, so I can put it over the acupuncture point and hold it there. Whereas a lot of veterinarians, they're using a class 4 laser, and those ones they can produce some heat, so you have to keep moving them around all the time. And then, of course, there's surgical lasers, which are really hot because they actually cut through tissue. And we don't use those for therapeutic laser.
Yeah. Is yours the one that's like in a pen? It's like,
yes.
Yeah. My vet uses that when he does an adjustment. He'll just hold it instead of sometimes even doing acupuncture. He doesn't even need to do it. It looks like a laser pointer, basically.
Yeah, mine's a little bit bigger, but yeah, it kind of looks like a laser pointer.
Yeah. Interesting. All right. So, and then let's go a little bit beyond. So, Ozone. How are you using Ozone to keep your dog and cat patients well?
Well, we're using it in different ways, so it depends on what the animal is presenting with. So I'd say probably the most common use of it would be for digestive issues. Mm-hmm. And then what we will do is we will give rectal ozone. So we'll take the ozone gas, and we have a little catheter that we put up the butt end, and we infuse the ozone up there, and then we pull the catheter out, hold the tail down so he doesn't fart it out. And then, so that absorbs into the body. We'll usually combine that with some other form of ozone therapy also, because it does work better if we kind of hit it from different angles. So multimodal approach. And I'd say the most common one we combine it with is what we call minor autohemotherapy. So we draw a small sample of blood, we mix that with ozone gas. That blood will actually become very red because it becomes so oxygenated. And then we'll take that and inject it into the muscle. Because I'm an acupuncturist, I inject it into acupuncture points. So I've already assessed the animal, and it's like, okay, these are the acupuncture points that are active. These are the ones I'm going to inject it into. And I've trained my technician to do this. So she does most of the acupuncture, most of the ozone therapy. And I just tell her I want it to go into bladder 23 or whatever. And she'll do that for me. So we also can mix it with saline, and we can give it as a injection underneath the skin. We also can use it to flush wounds. So if you've got a wound that's got a lot of bacteria, instead of just flushing and cleaning it with regular saline, we'll flush it with this ozonated saline, and it has antimicrobial action. So we're killing off bacteria while we're cleaning off the debris off of the tissue. We can also mix it with a larger amount of blood, and we can actually give it right into the vein. We have to be more cautious with that one. But
Why?
that will really, well, because it's going into the vein itself. We don't want any blood clots going in there. We don't want any actual air bubbles going in there.
Sure.
We draw it direct from the animal. We mix it with ozone, and then we hook it up to our fluid pump, and we push it into the vein at a slow rate, so it doesn't go too quick, because we don't want to, shock them or anything. And we'll use that one a lot for cancer therapy. It's actually very good for cancer therapy. Some veterinarians will combine it also with something called UV light therapy, but I haven't gotten to that yet. Maybe someday, but yeah.
Wow.
So, and then the other one we do is we can mix it with water and just drink it. I drink ozone water every single day.
Yeah. Wow.
It really helps.
Yeah. My dentist, I gargle with it before and after my dentist appointment. First thing that happens when I sit in the chair, ozone water. So can you give me an example of each of those? Can we start with the one where you're giving it in acupuncture points, and can just an example of like why you would use that particular way of using ozone? So in the digestive, it's going up the rear because why?
Well, you put it up the rear end partly because that is the digestive system, and it's going to absorb into the bloodstream that's going into that intestine. And from there, all of the blood that gets absorbed from the intestine goes straight up to the liver. So it's going to get into the liver, and then it's going to go up to the heart and then circulate through the rest of the body. But one of the big things is that with digestive issues, you almost always have some liver involvement also. And in Chinese medicine, we consider the liver to be the one that actually spreads all the blood through the body too. So from a metaphorical concept, I'm actually spreading it through the body by taking it up to that liver. The injection into the muscle, because it's going right into the bloodstream from there, like not just to the intestine up to the liver, but directly into the bloodstream of any muscle at all. And so that's going to go through the rest of the body even better, because you're not going through that filter of the liver. I put it into the acupuncture points because then it's like I'm doing acupuncture at the same time. And so, for example, if I had a dog with kidney problems, I might say, okay, we're going to put it into bladder 23 because that's your point that's related to kidneys in Chinese medicine. Wow. So you put that in. So it's like giving acupuncture at the same time as you're doing the blood therapy. So you get a double whammy treatment.
Yeah, I'd say so. Okay. And then in saline?
In saline, well, if you're doing it just under the skin, then again, it's similar to what you would be doing with the muscle injection, except it's going under the skin. It takes a little bit longer to absorb, but again, it's going to be like a whole body therapy. It does sting a little bit. So we don't do, like if I had a cat with kidney failure and I had it in for sub-Q fluids, I'm not going to give a whole, 200 mils of ozonated saline as the sub-Q fluids. I'll give, maybe 150, and maybe then I'll give another 20 mils with the injection or something like that. So it's a little bit less, but that way we're actually bringing more oxygen into the body. And in Chinese medicine, they talk a lot about when the blood fluids are not moving smoothly through the body, they call it a stagnation. And we see so much stagnation that causes disease. And the stagnation, when you look at that blood, it's really dark. And to me, that's like, there's not enough oxygen in here. So if I can bring more oxygen into the body, my feeling is that I'm also helping to relieve that stagnation.
Yeah. Yeah. There's some states that don't allow ozone. So what do those people do?
Whatever else they can do. I don't know. I'm not in the States. I don't really know the regulations in the US.
Yeah. Yeah. But is that the case in Canada? Some provinces don't allow you to do ozone?
Not as far as I know. I don't think there's any restrictions that way.
Okay.
But it's also veterinary medicine too, right? So what's going on with the human world doesn't always cross over to what's going on in the veterinary world yet.
Yeah. You can buy Ozone machines and be taught how to use them yourself at home. So there's that workaround too.
Yeah.
And it's really safe as long as you know what you're doing, and it's really worth doing. But basically, all of those things have one thing in common: you're pushing oxygen in the system, and an oxygenated system, an alkaline system in the case of dogs, is a good thing. But oxygen is like anti everything bad for the most part. It helps with all the bad stuff really, really well. And I wonder if there's ever been a study of like, can you measure oxygen? Could you effectively measure the oxygen like in a hyperbaric versus an ozone treatment? I wonder. Then wouldn't that be cool to do?
There might be a study out there. We don't do hyperbaric chambers really up here. We have one veterinary facility that has hyperbaric chamber. They are a new facility. Very few of us veterinarians know much about hyperbaric chambers. Mostly it's down in the States and mostly in the horse industry. So a lot of my US colleagues do use hyperbaric chamber stuff, but I really don't know a whole lot about it because, well, I'm never going to be buying one. They cost too much.
Yeah, they're really, I mean, you can do blow up ones, but they're not as good. The ones that are made for dogs, I think it's called HBOT, HBOT. That's the one I've done on my dogs. And boy, I won't take the time, but there's a couple miracles in my dog. And one of the reasons I did it was it naturally creates, it stimulates the creation of stem cells. So where else can you get that? And you get oxygen everywhere, the brain, the eyes, all the organs, all that stuff. It's pretty nice. But it's a big setup. I mean, I saw the setup. It's like there was these huge tanks. I think they might have been nitrogen to push all the pressure, and it looks like a big submarine.
Yeah.
That's 100% metal. So it's a big expense.
Yeah.
I can only imagine the ones for horses, they must be like the ones like John Hopkins has one down in the ground that it's all concrete, and you walk into it, like 50 people at a time can go in it. So it must be something like that where you could just bring your horse down and your horse just stands and gets a little bit of pressure.
They walk the horses into them, is my understanding. But I also heard a few years back where one actually blew up. So it can be dangerous. So be careful.
Oh my gosh, yeah. Ozone's easy and it's much cheaper and much less time of therapy. So, okay, great. So now let's go back. Those are amazing therapies. Let's go back into Chinese medicine, Chinese herbs. How do you use those to support, like, healthy tissue, good older age, quality of life, all that stuff?
Well, my herbal therapy, I always combine my herbal therapy with my acupuncture. Well, I wouldn't say always, 99% of the time I do. It's partially because of how I was trained. I mentioned Steve Marsden. So I follow Steve Marsden's teachings. And he uses active point therapy to try and determine what the underlying Chinese medicine problem is with the animal. So I use my acupuncture. And then based on the changes that I got with the different acupuncture points, then I know what I'm supposed to do from a point of view of Chinese medicine. And then I'll choose my herbal therapy based on that. So for the older animals, then it might be supporting some organs. It may not be actually for the treatment of their musculoskeletal issues. Maybe I may actually originally have seen them for inflammatory bowel disease. So I'm still making sure I'm dealing with that as well as their musculoskeletal issues. Okay. Or I'll be arthritic animal. Obviously they're going to be painful. So I'm going to choose something that's going to help with that. In Chinese medicine, they say that the kidney rules the bone. So if you've got arthritis, you probably, from a point of view of Chinese medicine, you have some kidney issues. So I might be choosing a formula that's going to support your kidneys. And if you're a 15-year-old golden retriever, you probably are low in your Chinese medicine kidney. So you probably need some support for that just to help in your aging process. So that's kind of the way I would use it in my senior pets, to support their deficiencies and to help to clear some of their excesses. Excesses like pain, that would be a pain type problem. So it really depends on what they're presenting for and how I'm going to use it. But I almost always use my acupuncture to help guide me. The other thing I'm going to be basing it on is, what does the owner of the dog, what does the client want me to do? Like, do they want me to help this dog move better? Well, okay, I'm going to focus on that. Do they want me to help this dog with its stinky skin? Yeah, I'm going to focus on that. But always in Chinese medicine, in a holistic approach, we've got to look at the whole thing, and we have to be treating our Chinese medicine diagnosis, not the Western medicine diagnosis. So that's what we always have to remember.
Okay, interesting. So, all right, that's great. So, what about the nutrition? Do you do traditional Chinese medicine within the food? Like, do you practice a lot of that with your clients, like damp dog, dry dog, hot, all that?
I'll do a little bit of that. I mean, obviously, if you've got a damp dog, you don't want to give it damp foods, that type of thing. But more of it would be that I don't want a dog on highly processed food.
Yeah.
So that's my biggest thing, is trying to get them onto something that's not processed. So not kibble. The kibble is your worst thing possible. But there are some people who just, they have to feed kibble because it just doesn't fit their lifestyle. So if they're going to do that, then I'm going to try and say, okay, well, let's supplement with these foods that will help out. So it really depends on the patient. But I would have to say, majority of my patients are either feeding a raw food diet or they're feeding a gently cooked diet. Or if they're feeding kibble, maybe they're also feeding one of the meals as one of those other non-processed foods. And then we'll be looking at, if you're buying a commercial food, then can we supplement that with something else to help with your animal's particular condition? So that's where the Chinese food therapy would come in. Or let's say if you had a skin disease dog, which is generally a hot condition, and the client was feeding a lamb-based diet, well, I'd say, well, I don't think we should be feeding your lamb-based diet because that's one of your hottest foods. And you've got a dog who's extremely inflamed. So if we're going to feed a diet, let's not choose lamb. Let's choose something else that's a little more cooling. Let's, choose turkey or something like that. So that would be where the food therapy point comes in.
Yeah. Interesting. That's great. So I think this has been super informative. Tell us more about your practice, which we have up on the screen. People in the area near you, how do they find you? Tell us a little bit about how your clinic works.
Well, the best way to find us is by going to the website, pineholisticvet.com. If they're interested in becoming one of our patient or clients, there's a submission little thing that you hit, and then you fill it all out. Thing that they should know, though, is that I'm not accepting new patients right now.
Yeah.
So my practice is closed, but I have an associate, Dr. Dana Clayton, who is accepting new patients. So, she's not trained in acupuncture yet, and she's not trained in chiropractic yet, but she's trained in food therapy, a lot of natural nutrition type of stuff. So a little bit heavier on the nutrition side than I have. And she also is trained in Chinese herbs and Western herbs. But the best way is really going to that submission page and then putting all your details in there, and then we will respond back.
Great. How long do you guys spend with your first clients?
Dr. Clayton spends about 2 hours. I spend 2.5 to 3 hours.
Wow.
Yeah.
Wow, that's amazing. I mean, the norm is usually hour and a half first session. That's wonderful. Why do you spend that much time? I mean, I'm leading you to a question I know the answer to, but tell us why you spend that much time, not an hour and a half. Like, give us some reasoning, because I want people to hear that these short vet visits, they don't work. They just don't work. So give us a
Yeah.
little bit of that.
So even prior to, for an initial appointment, the veterinarian has received all the records from your previous veterinarian. They've reviewed it all. We'll spend hours going over those records to try and find out what it is, the underlying issue that's the problem for the dog. We have an intake form, very detailed intake form that people fill out that we'll have reviewed. And then when you come into the room, we're going to talk to you initially about all the things that you mentioned on your intake form, because those are where you mentioned that the problems that we have to deal with. And there'll be some questions that we have for a little bit more information, clarification, that type of thing. And then we'll do a hands-on examination. So when we do a hands-on exam, we're going to do a regular conventional exam, just like you would for your regular vet. But I also am going to do an acupuncture exam. I'm also going to do a chiropractic exam. And with that, because of my training, I'm also doing some gait analysis and that type of thing too. So all that takes time. But the longest thing is the discussion period that we have afterwards, because we need to discuss how we're going to treat that animal. So a lot of it is diet first. That's the very first thing we probably talk about, because if you don't change the diet, you can do all sorts of things, but you've still got inflammatory diet going into the body, and that's not going to resolve. Some people aren't ready to do that change right away. We understand that, but we need to touch base on it to explain to them where our goal is going to be. The other thing that we always have to do, because we're trained as conventional vets, but we're not always doing it, everyone has to understand why we're doing this differently. Because the other people they'll have a conventional vet they go to, and they'll say, oh, you got to feed KD diet for your kidney cat. And we're going to say, no, you're not supposed to feed that. That's a really bad thing for you to start off with. Your cat doesn't need that at this point. So we have to explain why they're going to get that information from the regular vet, and why we're going to tell them the opposite, and why we can tell them the opposite because of the support that we're going to be using with herbal therapy or acupuncture, or whatever we're going to do. Because we don't want to put them onto those diets when the dog or cat is not at the point in life when they're supposed to be on it. There are some times when they need to be on something like that, but actually not that often.
Yeah.
You can usually support them in some other way.
That's great.
So it takes time.
Yeah, they do. These things do take time. I think it's a huge red flag if it were me. If I'm interviewing a vet and I see the appointment time is an hour and at least 30 minutes of that is with a vet tech and not with my vet, I just would wonder, what am I able to get done here? Like how am I really going to get to the root cause of my problem? Or am I just going to get prescribed something to get me in and out of the appointment quick enough,
Yeah. Well, actually, the part where like half an hour with your tech, that's that intake form that we have you fill out, or the questionnaire that we have you fill out before the appointment. That enables us not to have you spend 15 minutes or something with my technician gating all that history. I actually worked in conventional medicine in a situation where we had the tech go in first. Yeah. And then what I found is when I walked in the door, the client would then just tell me everything they just told to the technician. So why did I have my tech go in there in the first place?
Right.
It didn't make any sense to me. So I don't do that model. I don't think it's very useful. I like to hear it from the person's mouth, because they tell it to me a little differently than they tell my technician.
Yeah, that's great. Well, I really appreciate this time with you, and all of the things you've told us, especially about keeping our dogs feeling good, all of their muscles in a nice, healthy, relaxed peak state. And it's a big thing. So, and obviously all the other therapies you do. So Dr. Kinoshita, it's really nice to get to know you today.
Thanks for having me on, Ryan.
Yeah. And pineholisticvet.com, the word pine, holistic, VET.com for those of you just listening. And you're north of Toronto, we learned today.
Yeah, we're at the south end of Georgian Bay.
Awesome. Well, that sounds nice. And everybody, thank you for joining us. Make sure you subscribe, like, and comment if you have any questions below. Thanks. Bye-bye.